Well, hi everybody, this is Nicole from New Life Counselling and Psychology. I want to say thank you first of all for those who are listening and have subscribed to this channel. And I'm glad you have, because today I have Dr Amrita Dhital with me. Welcome, Amrita.
Thank you.
Dr Amrita is one of our local GPs here, and you may have seen the previous podcast where Julie Marsh, the dietitian, was talking about those GPs that have really specialised care, and Dr Amrita is definitely one of them. I've just got a couple of little pointers here about her that I got from her PA/practice manager, and I believe you've been practising since about 2013.
Yes.
Is that right?
Yeah.
That's quite a while.
It has been.
Yeah, and being very dedicated to your patients is what I'm told, and I definitely hear that because I'm actually at the clinic myself one time in the week, and I know that Dr Amrita is very, very popular, and it's also very hard to get in to see her. So thank you so much for coming. One of the things that prompted me to have Amrita here is the fact that I saw a reel. We've actually had a couple of conversations obviously at the clinic, but I saw a reel recently where you were talking about menopause. And we know, and I had a quick chat to Julie about this last time, but we know that menopause is a subject that's only really starting to get airtime in the last few years. So it's always really great to hear what professionals are hearing and what I guess women are experiencing as well. So is there anything there I'd love you to share on your experience and what you think about that topic as a doctor?
Sure. First of all, thank you very much for having me today, and thank you very much to all the listeners and viewers. Thank you. So in terms of menopause, as you correctly said, there has been a massive shift in terms of the awareness. So a few years ago, people would come in to see me for one particular symptom of menopause, and maybe another symptom is being looked after by another GP, and then another GP. So, it wasn't... people didn't have that awareness as much as they do now,
and maybe
which is a great thing
as well, because you're separately looking.
And at that time, I remember I had to sit down and try and explain the patient that, look, all those symptoms that you're seeing different GPs for, that's actually under one umbrella. It's it's menopause. So we had to work a lot in terms of raising that awareness.
Yes.
However, at the moment, these days, what we see is it's a great thing. I feel really good about that. People come in and say, Amrita, am I going through menopause? Amrita, am I going through perimenopause? It's a fantastic shift that I've been seeing in general practice.
Good.
And that's amazing.
Good.
That's amazing. Yeah.
I know for myself personally, in the last, I would say, 6 years, I've had that journey, and now I'm post, and I didn't even think about it. And I was going through different symptoms, and I didn't even think of asking anyone about it, and it's crazy how it's so different now. So I'm really pleased for people that they feel heard now and comfortable that situation.
That's right. In past, I believe mostly it was related to maybe just life. Stress, a lot of things going on. That's why I'm feeling this way. Yes. But now knowing that it's actually menopause, now people are starting to seek professionals' help and then do change little things in their lifestyle to help make a difference.
Yeah, absolutely. Are you finding that patients are actually really feeling relieved when they come to you knowing that you've got, hey, it might be this, and things such as that?
Absolutely. They feel validated. That huge. Not just making this up or, it's just something weird happening, Because a lot of hormonal changes are happening within your body, and it gives various symptoms. And it's hard sometimes because, the symptoms may range from hot flushes to night sweats to mood swings to sleep problems to, dry skin. It's like various range of symptoms. And then it might be tricky for patients to put everything under one umbrella, right? So when we say that, actually you're going through menopause or perimenopause, they get that sense of relief that, okay, this is real.
Yes.
You know, that's what I get to see.
Yes, absolutely. And on one of those symptoms, if we talk about sleep disruption, and that is so important to have sleep for physical wellness, for mental health.
Yeah.
I know in my practice, sleep is a big part of what we check for. When I first started in this area of psychology, my supervisor said to me, check the sleep first. Sleep has to be good. That has to be attended to because it can exacerbate so much the mental health. So that's where there's a big crossover in terms of, you know, the CBT associated with sleep, people and their strategies, because we could probably sleep better because of the hormones with estrogen and so forth prior to menopause, but once that kicks in, there sometimes has to be more attention given to that, which can often mean the mental health aspect, the thoughts that might go around, rumination, things as such. And I know that you understand all of this, Dr. Amrita, because you're someone who is very interested in the mental health of your patients. So tell us a little bit about that.
Yeah, sure. So, you know, I'm quite passionate about lifestyle medicine. And sleep is one of the big factor in lifestyle medicine, right? As is mental health, right? So, you know, nutrition, exercise, sleep, social connections, avoiding all the harmful substances, you know, they're all related in some ways or the other for your well-being, right?
Absolutely.
And sleep definitely it plays a big role. So once we have a good sleep cycle, then everything starts falling into the right place gradually. So for some people, that could just be that small shift. You know, they need to make to get the other things aligned in the right place.
That's perfect. So, that's exactly what I find as well. That's really, really good to hear. And so your mental health journey in terms of study or interest, or I know that you've, in terms of lifestyle as well, you've got some things coming up. Can you speak to us about that?
Yeah, sure. So, as I said, I'm so passionate about lifestyle medicine, and the reason behind that is I feel, yes, treating medical conditions, yes, that's great. Preventing chronic problems, yes, that's great. With lifestyle medicine, what I find is, yes, we're doing all those, you know, prevention work, but what are we getting right now out of that is the well-being right now. And feeling great, feeling confident, feeling, you know, feeling amazing right now by doing all those little shifts in our life, little behavior changes, little lifestyle modifications to feel the best now. And isn't that a great thing?
It sure is.
So that's why I thought, okay, I would really love to explore more in that space and practice more of lifestyle medicine so I can help more patients to live happily, healthily, and have the best well-being
quality
now.
Of life.
Yeah, quality of life. And it's not just for the person who's working on it, it sort of has the ripple effect on the friends or family or relatives and at work, you know. So, and then one day, if all of us are practicing this preventative health and feeling great, one day I believe the next generation will get the ripple effect too.
That sounds amazing.
So I think it's a long-term goal for me. You know, there's a
and you have to start somewhere.
Yes, we have to start somewhere.
I love that vision. That's incredible. That's really powerful. I find that in mental health as well. Sometimes a little tweak can make a big difference. So the whole lifestyle, and that's the name of this podcast, actually, lifestyle psychology. So we've obviously got a very big commonality here. But I really love that, Amrita, that you're doing that work. And I actually think it's quite pioneering. I'm not sure if I've heard of other GPs integrating all of that in a very specific and focused way that you're looking to do.
I felt that gap myself.
Yes, amazing.
Because I've been practicing as GP since 2013, and yes, general practice can be quite busy when, you know, you just have to see so many patients in a day, and then as you can imagine, different patients who walk through the door have different problems, right? And we're dealing with different problems with when you're trying to be empathetic and you're trying to be there for the patient, every 15 minutes, your emotion yourself is going up and down like that throughout the day. So it's quite challenging. So, you need that time and space to be working in lifestyle medicine. It can't be done that quick.
Because of the holistic approach.
That's right.
Yes,
so, and I felt that, okay, yes, we do all the GPs, they do a great job. They recommend lifestyle modifications, and but the gap that I found is that time constraint. Because of that, possibly we were not able to explain as much, engage as much in terms of just that part of lifestyle modification bit. Because there's a lot more to cover as well, right, for any doctor to help the patient. So I thought, okay, how about I take that role just to work in that space of lifestyle modification.
That's exciting.
And that will help other doctors as well in the practice, to work on the other areas. For the same patient.
Sounds a little bit like a bit of a coaching type of...
Correct.
That's what I'm hearing. So you have your incredible medical experience and your mental health, and I know that you're doing some more studies in that area soon as well. So it sounds, a bit of a coaching space, and what a great opportunity for people to get some real depth of knowledge, which we know is evidence-based, because you would only do evidence-based work. And to say, okay, overall, how am I going, and working in conjunction with a dietitian or a psychologist or different people in the field. Perfect. Amazing.
So just on that, I've been doing lifestyle coaching course through Harvard Med School. It's been pretty amazing. So what I'm learning out of that is how to wear expert's hat and how to wear coach's hat.
There you go.
So it's going to be a combination of both, and I'm loving it. It's a great experience with that course. And
so groundbreaking. So we've got it here, folks, in Greater Springfield in Brisbane, Australia. Will people be able to connect with you who aren't in the area to do this type of work as well?
Absolutely.
That's really cool. But what is really powerful is the holistic aspect, and we know if there's a breakdown in your physical health, it can impact your mental health, and vice versa. Being too stressed or anxious, it definitely has physiological effects on our bodies. So it's very, very important work. That's really cool to hear. Excellent. Is there anything else you wanted to add to that, or raise a new topic? I've got another question I can ask you. Okay, cool. So we had a little chat about a year ago, I think. Once again, in one of those quick moments that you get in between seeing patients and clients. And you had come to a point in your life where you were thinking, I need more balance. And I'm just wondering if you would like to share something about that, because people would look at GPs, and I'm just thinking from the average person, before I've actually worked in a clinic with one, and they would say, wow, they're just so busy and so qualified and work so hard and all of that. And I really enjoyed hearing what you said, because I think in general in the world at the moment, people could really benefit from that type of wisdom.
So look, GP's life is nothing different than everyone else's life. We're all busy.
You heard it first here.
So everyone is busy, and we are too, right? So at some point in my life, I was, I felt like, it's just too much. I had so much on my plate, especially when my dad was going through, terminal illness, and I was looking after him, looking after my patients,
and you had children,
and business to look after as well. And then, at that time, I felt like, oh my gosh, it's a lot. It was hard, but one point came where I just sat down and thought about, okay, how do I modify this? How do I change this?
Good question to ask.
So I started looking within me. That was my, turning point.
First go-to.
Yes,
Right.
yes.
Right.
And when I started looking within me, I asked some questions to myself. Who am I? What are my core values? What is my purpose in life? So when I started looking into that, it took a while for me to figure that out. There weren't easy questions.
Didn't happen overnight.
No, it took a while. And when I could answer those to myself, then I started changing things around me that I had control over.
Wow.
And there are things that we cannot change.
Yes.
That's out of our control.
Ooh,
So there's no
that.
point in, trying to go against those things.
Yes.
No.
Yes.
But there are certain things that we can change and modify and transform.
Yes.
That's in our hands.
That's right.
So I just started working on those things, and one of those was setting boundaries for myself.
Ah, okay.
Game changer.
Oh, wow.
And
so
when
you
I
weren't a good boundary setter prior to that?
No. I could easily say yes to everything.
What do you think was driving that, Amrita?
That was possibly my upbringing.
So maybe cultural
Yes.
or familial or both?
I grew up in a joint family, so massive family, and then for us, day-to-day life was like a lot of people around us and a lot of celebrations, festivals,
Wow.
and that's beautiful. I've got great memories of my childhood, but it followed on.
Transposed over to adulthood?
Yes, that's right. But then at the time, I was a kid and I could celebrate everything, enjoy my life. But
You didn't
now,
have big responsibilities.
exactly, that's right. But something has changed over time, hasn't it? I'm an adult. I've got so many responsibilities, right?
Yes.
So I've got my business, I've got my patients, I've got my kids, my husband, my, mum to look after, and I've got my close relatives and my friends, So there's so much more now than I had when I was a kid. So I had to set the boundaries, and then I realized I could, look, the time during the day doesn't change.
That's
It's
true.
24 hours.
Yes.
But what I figured, I could create space in my day for myself.
That's a great simple first step, isn't it?
Yeah, absolutely.
Yes.
And what I did
that.
with that extra space that I could create in my day-to-day, I started looking after myself even better than I used to.
Okay.
And that started flowing for me. Like my sleep got better. I started eating healthier because I had more energy. I was motivated to do things.
Yes.
I had more time.
Yep.
I could focus on my exercises more than what I was able to. Because in past I had excuse that I'm busy.
Interesting.
But I created that space.
Yes.
So I don't have excuse. I've got time to enjoy the exercise that I love doing.
I love that.
So I love doing yoga. And I have time and space for that.
That's amazing.
I do meditation. That helps me keep grounded, focused, and being positive. It helps me with those things. So once I could create that space for myself, I felt the ripple effect in my family as well.
Oh, wow.
And
Which would
it's
then feed
really-
your soul as well.
Absolutely.
Yes.
And I get that, rebound reaction or response, I would say, in a nice, lovely way. So I feel it all starts within you. And linking it back to lifestyle modification. Look, you cannot change someone else's lifestyle. You are the one to change your lifestyle, so you can empower other person to change theirs.
Modelling, for example.
Absolutely. And then everyone around, once they're in their best self, it's a happy place.
Oh, that's so beautiful. Isn't it? Your best self, it's a happy place.
Absolutely.
That is a beautiful little four-worded, I think it's 4 or 5, whatever it is. So do you feel as though you had to pull back and go back to a really strong foundation in your health by creating that space for yourself? That sounds like that was the first step.
Yes.
But the first step was the introspection. Where can I pull back? Where can I set some boundaries?
Correct.
There's so many people these days, when I talk about boundaries in my practice, they're often on that treadmill where, they feel like they can't get off, they can't say no, they can't, you know. Did you have that pressure happening for you, or did you give yourself permission to do that? How was that little journey?
Once I learned that as much as yes is a valid and respected answer, no is as well. And it should be.
I love that too.
You know?
Respected answer.
Yeah, that's right. So many times I've felt when my patients shared with me as well that, you know, they people pleaser, they just cannot say no.
Wow.
But most of the time what I figured is it's mostly the person who's saying no is feeling bad about saying no rather than the other person.
Yes.
You know what I mean?
That's a good way of looking at it.
Yeah.
Absolutely.
So once we look at no as being a good, valid,
empowering
and respected answer, then you don't feel bad about saying no. It's for your well-being, for your family's well-being, right?
Love that.
And it's okay to say no when it's right to say no.
That is so powerful. Being able to put those little nuggets forward to your patients in this capacity, I mean, you do it anyway already, but in that more coaching, well-being, lifestyle style is going to be incredible because people have that respect for you already, respect for the medical field, GPs, etc. So it's really going to be a great thing. Yeah.
And every day I feel really grateful for getting this platform of being a GP and being able to coach people.
So good.
You know, I feel like it was just meant to be for me. You know,
like a calling sort of situation.
Absolutely. Yes. So I really love what I do, and going to work is like a, you know, it's a happy place for me. I love my co-workers. I love my work. I love what I do. And I love to see my patients as well. And when I see them transforming their lifestyle over time, that's the biggest joy I get from.
Joyous, absolutely.
Yeah. It's amazing. So and that makes me more motivated.
Yes.
Yeah.
That's perfect. One of the things you were talking about is what are your goals, what are your values, and recently I've just done some education around ACT therapy. Well, it's not ACT therapy, it's acceptance commitment therapy. And one of the big things that I mostly do CBT, so cognitive behavioural therapy. One of the things with acceptance commitment therapy, it does talk about our values. So that time that you went through, what is important to me, what are my values, what are my goals, it's very central to this. And what we do is we say, okay, these are your values, now this little path I'm taking here, is that going to work towards my values, or is it going to walk away from, or this behaviour I'm doing, or these choices I'm making? It's like a bit of a choice point. So values are really, really important, and I think you make a really good point that you took some time to some introspection to really look seriously at this, because we can have so much on our plates day to day, but I think it's a really great exercise to really have a think about what is important to me, what are my values, how is my values impact my family, etc., and those around me, and the influence. And you've got quite a big sphere of influence, your own family and friends, your employees, your patients, all sorts of things. So yes, very, very good stuff. Yeah, great. Yeah, can you think of anything else that you feel would be interesting for our listeners to talk about? And I'll check what I have written here.
Look, I think one message that I want to give to our viewers and listeners is look within yourself, do your self-study. Let's find out what we want.
Yeah.
And then create time and space for yourself to begin with. Yes. And then you'll see the ripple effect. So excellent. Self-compassion, self-love, looking after yourself. It's not being selfish.
That's a very good point.
It's not.
Yes. Self-compassion is a huge thing in psychology at the moment.
Yeah.
Self-compassion, because we give a lot of compassion to other people. Yes. So self-compassion, we need to do that for ourselves so we are living our healthiest life, best life, and that will then impact everyone around us, like you said. And it all comes under self-care, all that you've talked about. No, it's not selfish. I don't believe we were put on this earth to just work ourselves into the ground or not be happy, as you say. So that's fabulous. fabulous. You got some beautiful nuggets of gold there.
Thank you.
Amrita.
Sometimes I tell my patients, I ask them a question that think of someone that you love the most in your life, and then I ask, do you love yourself the same way?
Yeah.
And you got the answer.
Wow.
Yeah.
Yeah. Well, that sounds like a really lovely note to end on. I think you've answered everything and more that I was interested in, and thank you for sparking that curiosity in me, because I know if I'm curious about something, there'll be a lot of people who are as well. So thank you once again.
No worries. Thank you so much for having me.
My pleasure. All the best with the new lifestyle clinic.
Yep,
and your studies. You're just in the right place and time. And this area is going to be so blessed to see that come to pass.
Thank you very much, Nicole.
Thanks, Amrita.
It was great. Thanks. Bye-bye.